everybody, this is Pastor Charles from Bux-Mont Baptist Church coming to you today with a resource video of how to stay mentally healthy in difficult times, how to help people who are having different mental health issues and different challenges. And I got my good friend here, Angie Baker, to help guide us in this. Angie has a master's of social work from Temple University. And then also she's a Master's of Divinity student at Missio Seminary and an evangelist and just has a heart for the Lord. So thanks so much for being on today, Angie.
Thank you for having me, Charles.
All right, fantastic. So just to jump right in, during this time, during the past year and a half, COVID, there's been a lot of challenges, a lot of mental health challenges. People had depression, all types of issues, but that's not anything new in human history. People experience difficulties, whether it's physical, loss of family members, injuries. There's a lot of things that happen in life that can become a challenging time. So I just wanted to ask you, how does someone stay mentally healthy when they're going through difficulty?
That's a great question, Charles. And again, thank you for having me on today. And as a social worker, we are highly trained professionals. And part of our job is to help improve the quality of life and well-being of others. And we do it through direct services, crisis, direct practice, intervention. We are good at researching, community organizing, and advocate. And so a lot of it can be done. And as a social worker, we pursue trying to help, especially with personal problems, as well as social disadvantages. And so how does someone help keep them to stay mentally healthy? When they have a balanced life, quality of life, meaning an individual well-being based upon important factors, such as social relationships, um, spiritual relationships, physical health, emotional healthy. Um, all of those are some critical means for someone staying mentally healthy. And when one of those are out of balance, it becomes and it causes some trouble for an individual. And so that's why, that's what brings us here. That's why I do the work that I do, because it is truly a pleasure and a delight of mine to help such persons as that needs my services. So yes.
Fantastic. And I think a balanced life is definitely key in a lot of stuff. Whenever we get out of whack in certain areas, what are, in a time where somebody is maybe not able to do some things that they used to, for example, COVID kind of limited our social interaction. So we didn't have as much social interaction. I know some people get really depressed when they have a physical ailment because they can't do the same exercising or activity that they used to do at that period of time, or there's pain and there's suffering in other ways too. And sometimes we just go through difficult times, and there's not much we could do about it. Losing a job or something like that. Are there any tips you have for folks when they're going through those valleys in life, on how to maintain the right state of mind in that? Because often in those valleys, sometimes people go even darker. It gets into a darker spot and not healthy, or they pacify themselves with drugs or alcohol. But what are some things that folks can do in those valleys to help them be in a healthier place, or help get them out of that valley?
Okay, that's a good question as well. But that's a loaded question. And so for me, first I would try to identify and understand what it is that they're facing, you know, and to be able to gain a better understanding of what someone is going through, we would have to have a conversation. Look, let's talk about what's going on. Let's assess your situation and then get a better understanding. Then I would also try to, one of the keys of anything is getting understanding. One of the other keys, once you understand, then you have to teach. So educating a person about whatever they're experiencing. So for me, I would want to clarify knowing the difference, helping someone to know the difference between anxiety and depression, because they are so similar, but yet they can be different. Um, and so once we can identify the symptoms that someone is having, symptoms of like their job, social activities have gone down, social withdrawing, isolating themselves, feeling hopeless, all of those can really cause a traumatic experience for someone, especially if they don't know how to cope with that, or don't have no support system. And I find support system is such a necessary need, and something, a coping mechanism for someone who is dealing with, these kind of crises and valleys. When someone is that low without support, they feel like they are, in it alone. They need to know that, listen, you're not alone. You got to stay connected. Depression makes us want to withdraw and isolate yourself as it is. Um, and then when you find that you're doing that, the best thing you can do is reconnect with someone, a friend, a loved one, your spouse. Talk to them. Tell them about what you're feeling. Talk to someone. Talk to a professional. If you can't talk to a professional, if you got fears or the stigma of, I'm not depressed, but yet you are depressed. You in denial of it because you feeling that low. You can talk to your pastor, someone that you trust that will give you a safe space, because it can be, you can be so low that you don't see no way out. That is that deep valley. And so that's one of the ways. Seek professional help, seek treatment if necessary, communicate your feelings, stay open to change, um, seek out seek out opportunities to, not bury your head in the sand.
Mm.
Like I said, looking for a way out. And then also one of the things that I find, in my practice or in my journey, has been people will think negative, and so they behave negative. So if we can change your thinking to some, with positivity and reinforcement and building on your strengths, you will find yourself, improving just your cognitive as well as your emotion. When you start feeling better about yourself, when you start seeing that there is a light at the end of the tunnel, then you can process your situation a little more better. And it does take sensitivity and skill setting for to help someone when they are in that place of loneliness, isolation, depression, and anxiety. Because it also, some folks can have some suicidal thoughts. And so with that, you would need some professional help. I will always recommend anyone who ever feels that way needs to call 911, or at least share their thoughts with a friend, someone, ask for help, get the help. Um, there is also a hotline that they can even call if they're feeling like suicidal. Um, yeah, if that,
That's fantastic advice. I think one of the things, and you said it multiple times, is if it gets real dark, if it gets real low, definitely seek professional help.
yes,
Too often People try to internalize those things or only reach out to one person who's not qualified
Hmm.
them the help they need, and so take it that next level. And I even think you touched on it too, when folks are in the valley, to reach out, you know
Yes.
reach out, whether it's to friends, to family, to pastors, to church,
Hmm.
church family, as well, and just really reach out. It's discouraging that oftentimes people do reach out, and they're not received or not guided in the right way. So I think I heard you say reach out to multiple people.
Hmm.
Just don't be proactive in that. And that's probably one of the hardest things to do in those valleys, but really is life-saving and life-giving,
Yeah.
folks. I think I've been in situations with people I know and love, and probably a lot of us have, where we see people going down a dark road,
Hmm.
and we see people disengaging and no longer communicating or connecting. And a lot of times we feel helpless. We try to do certain things. Sometimes they're probably right, sometimes they're probably wrong. But as a professional, is there anything that you recommend for people as we, come across friends and loved ones and other people who
Hmm.
are depressed or in a dark place? What do you recommend that we do as friends and family members?
Well, depression doesn't simply affect just the individual, the person that is depressed. It can also impact the loved ones as well. Family and friends are in the best position, though, for helping someone with depression, because that they see it. They see it beyond the person who is depressed. They really are like that first ones who can identify because they see them every day, or and so we got to realize that people, family members or friends, they have a special role in detecting, sometimes symptoms that the person may not even see, and they can be helpful in terms of just you know um being encouraging. They can also even persuade a person to seek out the help that they need. um Supporting someone with depression, I know that it can be difficult as well. It can be difficult as well because they sometimes don't even feel like they're helping, um or they're getting blamed for, causing someone else's pain. Sometimes it seems that way, but the truth of the matter is you are helping your loved one by not getting frustrated with them, not getting angry with them, but just continuing to try to just listen, be an ear more so than a mouthpiece. Pay attention to what is happening, pay attention to what the person is doing, and their behaviors, what is different, what has changed. And then you'll be able to, when they do seek out the help, when they all, because sometimes we want people to be ready when we want them ready. Everyone is, they won't always respond in that fashion. We sometimes have to be creative in helping, you know, as family members, because we do love them, because we do care about them, even our friends. We have to be strategic in our strategy and our approaches, I think, because sometimes it can backfire. And so, my recommendation as a tip, always pay attention, listen more so than speak, um, encourage more so than demand, um, support, go with them if they need, someone to walk, because it is scared. They are afraid just as much as you are. You know, they're actually, we may be feeling some of the symptoms, if a loved one may be going through it, but they are actually dealing with it. And that can be so frightening. So if we can support by learning learning some techniques from, from different resources. The internet is your best friend. You can find a lot of resources by Googling, some tips, some practical stuff. Don't be afraid of the internet. Embrace it. Um, yeah, yeah. Hopefully that helped explain
Yeah,
some
yeah,
stuff.
that's fantastic. I think one, just the encouragement that uh, a lot of times friends as friends and family will notice something and somebody will deny it,
Yeah.
like, nah, I'm good, or whatever the case is. But like you said, we know people by being part of their life and
Hmm.
can tell. So one, not to just disregard it.
Hmm.
And I heard you say, like, they might not be ready.
Yeah.
We might desire to push somebody through something
Hmm.
and to just get them past it. But in the Bible, it shows that it's okay to grieve, right?
Yes.
Grieve,
Yeah.
and there's seasons of stuff. So
Yeah.
somebody going through a season, and I heard you say, like, be patient with them, man.
Hmm. Yes.
Don't stop engaging them, but
Right.
be patient with them so that when they're ready, you can be a friend. And I think one thing that's real common too is to kind of preach or give instruction to people instead of being an ear or a shoulder for them.
Hmm.
And so, I think that was really valuable advice, because so often, somebody's going through a hard time and just say, hey, get up
Yeah.
and go get a job. They just
Yeah.
go
Yeah.
go get a job and do this and that, but there's some emotional stuff they got to work through. So
Exactly. Exactly.
yeah,
Because it's not necessary that they don't want a job. You know, they may. I mean, it all depends on the scenario. You know, um, it's sometimes the lack of interest is part of the symptom of depression. You got to understand the condition in order to be able to help with a solution. And so every problem cannot be fixed like a step by step. You gotta like I said, some situations requires, because there's some levels of depression. You have major and you have minor, you know what I mean? And then you might have that in between. So you gotta really do the work that comes with this condition. And so, like I said, understanding the condition, knowing what depression is, understanding how to treat it, utilizing some tips and resources, um, even doing the work for yourself. I recommend all kinds of sources for help. You have from like I said again, you can use your primary care as a means to get assessment. You can use a psychiatrist. You can use a social worker. You can use a therapist. You can use a friend. You can use a pastor. You can use a parent, being a parent, because children also deal with depression. We don't want to admit it, but they do go through trauma experiences as well that leads to, and so there is so many avenues to this that it cannot be all summed up in one segment. It is a process, and resources are available, but the main thing that we have at our disposal is being patient, listen attentively to someone when they're especially going through a period like this. Um,
yeah, I
we
think,
don't want to do we don't want to set off triggers, because sometimes when we look at substance abuse, for example, it can be something that triggered from being depressed, and then next thing you know, we're using that to cope with the issue. We're using alcohol or drug of choice to cope with while you're depressed, and then that all that does is lead to another bad habit. It does not correct the problem. It just, all it does is just suppress the problem or agitate the problem. And so, and we still got and we still got the problem, you know. So then we just added on another issue to an issue. And so, but you won't understand it unless you're going through it. You know what I'm saying? So some people have a hard time understanding substance abuse, why people do what they do.
Yeah.
Um, and so when we can get to those underlying issues, then and that requires some time and assessment. You got to be with people in order to understand where they are to be able to help them with what they're facing. And
And
depression
also,
and anxiety is real.
yeah, and I think also a key to that is the professional training, right? Like I keep hearing you,
Yes.
you go back, go back to it and just, ultimately, I think the stigma around seeking professional help is horrible,
Yes.
and people should not be embarrassed about that.
Not at all.
Everybody needs support
Yes.
and assistance working through different things in their life at different periods of time. So, if there's anybody watching with any issue,
Mhm.
whether it's depression or substance abuse,
Mhm.
anxiety, do not be ashamed about reaching out
No.
to a professional. Um, those people are there.
Yes.
People with a heart for service and
Yes.
really a love for people in need like you.
Yes. Yes.
So there should not be any shame in
Mhm.
reaching out to a mental health professional,
No.
a professional social worker, a licensed social worker, or a social worker or counselor,
Mhm.
because even if it's not as bad, or you're talking about the levels of depression or
Mhm.
levels of substance abuse, there's different substances. uh, Having a professional who's trained and knows the assessment tactics, knows the therapeutic ways to deal with things,
Yes.
and knows the resources is invaluable.
Mm.
So you definitely want to encourage folks, whether it's you, a family member,
Yes.
friend, or anyone in your life that's having difficulty, encouraging them to go to a professional counselor, social worker, or a therapist is a great thing to do to
Mhm.
encourage them, regardless of the problem, and just help break that stigma so that
Mhm.
people feel comfortable doing so. I think so often in anything in life, if we reach out to others, if we engage others,
Yes.
engage people who have the right experience, we can overcome anything with obviously God's grace and guidance. And depression, substance abuse, anxiety, mental health issues is no different.
Mhm.
Get a good team around you, get people who care for you and love you, and seek professional help is really what one of the main things I hear you saying is, like one, you said it doesn't have to be that, but that is not a bad way to go in any circumstance.
Not at all. You're right. Correct. You are so correct.
Thanks so much, Angela. Fantastic advice for folks as well. And what we'll do is we'll also put a link inside the description section of this
Mhm.
video on some local resources that you can look
Yes.
for mental health. And again, this video is not to take the place of a counselor or
No.
take the place as a mental health professional, but really just to encourage you to deal with those things, encourage you to try to live a balanced life, a
Mhm.
holistically healthy life, so that you don't fall into dark times. But if you do, please seek help. And at Bux-Mont Baptist Church, we want to be a blessing to you. If there's
Amen.
a way we could be of help to you. If you're struggling with something, you have needs or issues, please reach out to us. We would be honored to help you. No judgment, just trying to help you overcome any obstacles in your life. So please reach out to us if you need anything. Thanks so much, Angela.
Thank you for having me. And I trust that God bless you all. And that was a great segment. And again, just to reiterate, please don't stay isolated. Reach out, talk to someone, share your concerns. Don't internalize it and keep it all to yourself. Speak out. There's so much strength in your voice, and we're here to help you any way that we can. Um, and take care.
Amen. Thanks so much.
Yeah.